Jeevay Sehat is an online medical healthcare facility in Pakistan. The total population in Pakistan, as of right now, is over 220 million and 423,000 doctors, which leaves us with a very undesirable ratio of 1 doctor for every 520 patients. Patients have difficulty finding appointments from the doctors at the time of need, and patients have to wait in line for really, really long hours till the time they actually get the consultation done. So Jeevay Sehat is seamlessly connecting patients to doctors through video consultation from any part of the country, making healthcare more accessible for all. Okay, so the solution is twofold. One, we have Jeevay Sehat application, which is available on Android and iOS, as well as mobile optimized application. So it's very simple to use. The user registers, then then fixes an appointment with our registered doctors on the application, and then pays online to actually have the video consultation done. Second is Jeevay Sehat integrated telemedicine device that we're calling JSITD. So it's the same process, but what's different is that the nurse has to take the device to the patient's house after they've made the appointment and then connects them on a video consultation with the doctor, who then analyzes all the vitals of the patient and do the online real-time prognosis. So the pricing model is such that per video consultation, we're charging rupees 500 to 700, and we're keeping a 10% commission for Jeevay Sehat. And JSITD, we're charging 1,600 to 3,000 per consultation. Expected conversion rate is 5% over 3 years. And since the past 2 months since we've launched, we've earned about a little over $1,000. We're expecting to get 259 million sales revenue in over 3 years. And the team includes 3 doctors that are based in UAE, and they have over 15 years of experience in consultation, including 2 pediatricians and 1 orthopedic surgeon. And myself and Sohaib Shari are actually in Karachi, Pakistan, and we're doing all the operations and strategy for them. We are looking to raise and expand with $1.2 million, which we'll be investing in rural healthcare program as well, and creating and expanding the mobile clinic operations in Pakistan. Thank you.
Okay, Andy, you want to go first?
$259 million in 3 years?
Yes.
That would be would it be the fastest growing company in the world ever? That's your plan? Just checking.
How do you get to that?
Yeah, how do you get there?
Yeah. Okay, so the hospital industry in Pakistan is quite huge, right? It's about like almost, I believe, $500 billion. And so, we're actually looking at that, and we're targeting every single person in there, whoever wants to get connected to the doctors at any point in time, because we feel that, and we know that there's a need for it, because there are very less doctors for a lot of patients out there. And there's a lot of traveling time and everything that we want to reduce and make the access of healthcare more easier for everybody and lower cost. And also, we're planning to launch JSITD, which is a Jeevay Sehat integrated telemedicine.
Who's this guy?
Oh, this is Sohaib Shari. I mentioned him in the team. So we both are actually working together for looking after the operations in Pakistan.
Andy, go ahead.
So, again, just clarifying the 259, does that assume that you have, what % of the total market then? Are you assuming that you'll have competitors that will also get a piece of the market, or are you thinking, how much of the market will you have?
Okay, so we have selected about 8% of the entire market that we have, which includes patients going up to like all the hospitals. We haven't even considered the dispensaries right now or the medical camps. It's just hospitals, right? So 8%, and we're looking to get to 59 million over 3 years, right? So that's accumulative of that.
Go ahead and add.
Yeah.
Use the mic though.
Yeah. So,
Use this.
all right, thank you. So I just wanted to add, she's absolutely correct about that. And one of the reasons why we have projected about $259 million is that Pakistan being the 5th largest population in the world, we have over 200 million people. And healthcare is something regardless of whatever class you belong to, everybody must have an equal opportunity to have healthcare. And just like she said, rural healthcare is also another program that we're looking into. And we want to make sure that this penetrates every region in the country, because it's really important. Our urban population, as compared to rural population, is 1/3 of the entire population. And the rural program will also help. And the total population of the doctors in Pakistan is just
423,000.
yeah.
So
And that means one patient is to 520. Sorry, one doctor is to 520 patients.
yes.
So this platform is a solution to ensure that healthcare is provided
It's
to
more
everybody.
accessible. Yeah.
Is accessible.
Last quick
Absolutely.
This technology is not unknown. There are a lot of people doing it. So why, are you the only one in Pakistan? They can't be. Are you the only ones in Pakistan doing video conferencing with doctors?
Yeah, absolutely. Because the thing is that some of the hospitals, they're using WhatsApp or Skype, and they have internet connection issues. And but this application itself supports the instant messaging and video conferencing. We've tested it for almost 3.5 months, and
Yeah, I have cut you off. Thank you.
Thank you.
Thank you.